Good morning. We'll have a short discussion about the classification of impacted teeth. First, we'll see the classification of the impacted mandibular third molar. Then later, we'll see the classification of the maxillary and the maxillary third molar and the canine. The classifications of the impacted mandibular third molar, there are several authors who gave the classification for it, which includes Winters in 1929, Pell and the Gregory in 1933. According to the Winter, he classified the impacted tooth, which is based on the angulation, into mesioangular, distangular, vertical, and the horizontal. So it's a pictorial representation of the Winter's classifications according to the angulation, where we have to draw a straight line along the long axis of the second molar and along the long axis of the impacted third molar. When the two line, if it meets at the top, it indicates a mesioangular impacted tooth. If the two line, it indicates, if it meets perpendicular to each other, it will indicate the horizontal impaction. If the two line, if it meets at the bottom, it will indicate the distoangular impacted. If the two line, which will runs parallel to each other, will indicate the vertical impaction. Now coming into the Pell's and the Gregory's classification, who classified the impacted tooth according to the depth into position A, B, and the C. It's a pictorial representation where a position A indicates the highest position of the tooth is on the level with or above the occlusal line, whereas position B indicates the highest position is below the occlusal plane and above the cervical line of the second molar, whereas the position C indicates the highest position is below the cervical line of the second molar. And coming into the Pell and Gregory's classification in relation to the ramus of the mandible and the second molar, where he classified into class 1, class 2, and the class 3. Class 1, it indicates that there is a sufficient space which is available between the anterior border of the ramus and the distal side of the second molar. So which indicate that there are sufficient spaces available for the eruption of the third molar. Whereas the class 2 indicates that the space available between the anterior border of ramus and the distal side of the second molar is less than the mesiodistal width of the crown of the third molar. Whereas a class 3, it indicates that third molar is totally embedded in the bone from the ascending ramus of the mandible because of the absolute lack of the space. So till now, we have seen a classifications for the mandibular impacted third molars. From now, we'll see the classifications for the maxillary impacted third molar as well as for the maxillary impacted canine. Coming into the maxillary impacted third molar, they are classified according in relation to the floor of the maxillary sinus into the sinus approximation or the nose sinus approximation. Nose sinus approximation, it indicates the 2 mm or more bone is present in between the sinus floor and the impacted maxillary third molar. Whereas a sinus approximation, it indicates there is a no bone or a thin bony partition is present between the impacted maxillary third molar and the floor of the maxillary sinus. Coming into the classification of impacted canine, class 1, it has been divided into class 1, class 2, class 3, class 4, and class 5. Class 1, it indicates the canine is palatally placed, which is further divided into horizontal, vertical, and the semi-vertical. Whereas class 2, the canine is labially or buccally placed, which is further divided into horizontal, vertical, and the semi-vertical. Class 3, it involves both the buccal and the palatal bone. It means that part of the canine is present palatally and the part of the canine is present buccally. Class 4, it indicates that impacted canine is presented in between the adjacent tooth, which means that adjacent to the central lateral incisors and the first premolar. Class 5 indicates the impacted tooth, which will be present in the edentulous maxilla. It's a pictorial representation where it shows that class 1, so the palatally placed canine. Class 2 is a buccally or labially placed canine. Class 3, the part of the canine is buccally placed and the part of the canine is palatally placed. Class 4, the canine is located in between the adjacent teeth. And the class 5 is that canine is present in the edentulous maxilla. So these are all the classifications which is used for the impacted tooth either in the maxilla or in the mandible. In case of a mandible, there are 2 classifications, Pell and the Gregory's and the Winters classifications. Pell and the Gregory gave classifications into according to the depth as well as according to the space available between the distal side of the second molar and the ascending ramus of the mandible. Winter gave the classification based on the angulation. For maxilla, Maxillary impacted third molar, it's based on the sinus approximation. And the maxillary impacted canine, it's based on the position, whether it's palatally, buccally, or palatobuccally, or in between the tooth, or present in the edentulous maxilla. Thank you.